Hello, my name is Valerie Oropesa, and I am doing this video for my Math 0930 class for extra credit. I will be discussing FAS, which is fetal alcohol syndrome. This is a very important subject to me, especially because I am currently pregnant. Fetal alcohol syndrome affects 1 in 100 infants each year, more than autism, Down syndrome, cerebral palsy, cystic fibrosis, spina bifida, and SIDS, sudden infant death syndrome, combined. The saddest thing is that fetal alcohol syndrome is something that is preventable, yet so many mothers to be drink during pregnancy, causing infants to suffer from the many effects of their mother's drinking during their pregnancy. Fetal alcohol syndrome is a pattern of mental and physical defects which develops in some unborn babies when the mother drinks excessive alcohol during pregnancy. The ingestion of alcohol does not always result in fetal alcohol syndrome, but no amount of alcohol whatsoever is proven safe for consumption during pregnancy. Alcohol crosses the placental barrier, an organ that connects the developing fetus to the uterine wall to allow nutrients, waste elimination, and gas exchange from the mother's blood supply, and can stunt fetal growth, weight, create distinctive facial stigmata, damage neurons and brain structures, and cause other physical, mental, or behavioral problems. Surveys found that in the United States, 10 to 15% of pregnant women report to recently used alcohol at some point during pregnancy. The main effect of fetal alcohol syndrome is permanent central nervous system damage, especially to the brain. Developing brain cells and structures are underdeveloped or malformed by prenatal alcohol exposure, often creating an array of primary cognitive and functional disabilities, including poor memory, attention deficits, impulsive behavior, and poor cause-effect reasoning, as well as secondary disabilities, for example, mental health problems. Mental health problems. The risk of brain damage exists during each trimester. Since the fetal brain develops throughout the entire pregnancy, fetal alcohol syndrome exposure is the leading known cause of mental retardation in the United States and Europe. The fetal alcohol syndrome rate is estimated to be nearly 1 in every 100 live births. The lifetime medical and social costs of each child with fetal alcohol syndrome are estimated to be as high as $800,000. Fetal alcohol syndrome also affects the eyes. Many eye doctors are interested in fetal alcohol syndrome because of the frequent involvement of the eyes, which may cause significant visual impairment of the eyes, which impairment in children. Visual acuity, the ability to see detail, is reduced in over 50% of children with fetal alcohol syndrome. Some problems, such as high refractive error, as large amount of near or farsightedness, can be corrected with eyeglasses. Other problems that are caused by abnormal or incomplete development of the eye during pregnancy can result in a permanent reduction of vision. For example, the optic nerve may be small or abnormally developed, causing vision impairment. Less commonly, the cornea, the clear surface of the eye, and iris the color part of the eye, may show malformations that severely limit vision. Strabismus, an eye term, is present in 25 to 50% of children with fetal alcohol syndrome. Some possible problems include cataracts, clouding of the lens, and nystagmus, involuntary rapid movements of the eye. Changes in the eyelids are common in fetal alcohol syndrome but may not hinder visual development. Signs of fetal alcohol syndrome are telecanthus and droopy eyelid, which occurs in about 20 to 25% of affected babies. Uh, so, as I said before, no amount of alcohol is proven to be safe for consumption of pregnant women. My advice as a mother to be is if you are pregnant or plan to be pregnant, save the wine for another time.